You reach down in the dark, grab your calf with both hands, and you stretch it the way you've always stretched it, and you wait for the pain to pass. Millions of people over 60 do exactly this every single night, completely confident they're handling it correctly. But that stretching reflex you're relying on, the one that feels so instinctive and so logical, is in many cases making the underlying problem significantly worse. So here is the question I want you to sit with for the next 12 minutes. What if your nightly leg cramps aren't just a nuisance, but an alarm system, and you've been hitting snooze on a warning your body has been sending you for years? I'm Qalb. I've been in clinical practice for over 22 years, and in that time, I've worked with more than 9,000 patients over the age of 50. What I want to share with you today is not something you're going to hear at your next doctor's appointment. I want to be direct with you about why that is. The medical system is not designed to prevent the conditions that send you to the office. It's designed to manage them once they've arrived. Prevention doesn't generate repeat visits. Prevention doesn't fill prescriptions. The system profits when you stay sick, not when you get well. That is the honest truth, and it's the reason this channel exists. If you haven't subscribed yet, do it now and hit the like button. Every subscriber who joins us is one more person getting information the appointment system will never give them. We are working toward 100,000 subscribers who are choosing prevention over treatment. And if you're watching this, you're already part of that. Now, before we talk about what you're doing wrong, you need to understand what is actually happening inside your body after 60. Because these cramps are not random. They are the predictable, measurable, and unavoidable result of four distinct physiological changes. And once you understand them, everything about this condition suddenly makes complete sense. The first change is called sarcopenia. That's the age related loss of muscle mass and muscle fiber quality. After the age of 50, the average person loses between 1 and 2% of their muscle mass every single year without targeted intervention. That means by 65, you may have lost 15 to 20% of the muscle tissue you had at 50. The downstream consequence is that the muscles in your calves, your feet, and the backs of your thighs, the muscles most responsible for nighttime cramping, are operating with a significantly reduced reserve. They fatigue faster, they recover slower, and they are far more prone to the involuntary sustained contractions we call cramps. The second change is called peripheral vascular insufficiency, which simply means the blood vessels that supply your legs are delivering less oxygen and fewer nutrients than they once did. The arteries become stiffer, a process called arteriosclerosis, and the capillary networks, the tiny end delivery vessels deep inside the muscle tissue, become less responsive. Research shows that resting blood flow to the lower extremities can decline by as much as 30 to 40% between the ages of 50 and 70 in individuals who are sedentary. That means your leg muscles are already operating in a state of mild oxygen deprivation before you even get into bed. The critical point here is that when oxygen drops inside a muscle cell, the electrical thresholds that control muscle contraction become unstable. And an unstable threshold is a cramp waiting to happen. The third change is electrolyte dysregulation, specifically the declining ability of the kidneys and intestinal lining to absorb and retain magnesium, potassium, and sodium at the levels the muscular system requires. Magnesium is particularly important here because it functions as the biological brake on muscle contraction. Magnesium sits inside the muscle cell and physically blocks calcium, the mineral that triggers contraction, from doing its job until the signal to contract is actually sent. When magnesium levels fall, as they reliably do with age, that brake loses its grip. Studies suggest that up to 68% of adults over 60 have suboptimal magnesium levels, even those eating what they consider a balanced diet. That means more than half the people watching this right now are running their muscular system without adequate braking power. The fourth change is neurological conduction slowing, the gradual decline in the speed and precision of the nerve signals that coordinate muscle activity during rest and during sleep. These are called motor neuron signals, and they travel from your spinal cord down through your legs to tell the muscles when to contract and when to relax. After 60, the myelin sheath, the insulating coating around nerve fibers, think of it like the plastic casing on an electrical wire, begins to thin. Signal timing becomes inconsistent. The muscle receives a contract signal, but the follow up release signal arrives late or incomplete, and the muscle holds. That hold is the cramp you wake up screaming from at 2 in the morning. Here is the critical point connecting all four of these changes. They all respond directly and measurably to behavioral interventions, not medications, not supplements you need to buy. Behavior. But only when the behavior is done correctly. And most people over 60 are making a series of very specific mistakes that take what should be the solution and turn it into an additional problem. Let's go through them now. Mistake number one, stretching aggressively the moment the cramp strikes. When a cramp hits, the instinct is immediate and powerful. Pull the foot back, stretch the calf as hard and as fast as you can. It feels correct, it feels like you're fighting the cramp directly, and sometimes it does provide temporary relief. But here's what's actually happening inside the muscle tissue. First, a cramping muscle is already in a state of hypoxic stress, meaning the oxygen supply inside the fiber has temporarily dropped to crisis levels. The muscle has contracted and is not releasing. When you apply a sudden forceful stretch to a muscle in this condition, you activate a reflex called the myotatic reflex. That's the stretch reflex, which causes the muscle spindles inside the fiber to fire an additional contraction signal in response to the sudden elongation. You are in effect telling a muscle that is already seizing to seize harder. Second, aggressive force stretching of an oxygen deprived muscle fiber tears microscopic sections of the tissue, creating micro damage at the Z disc level. That's the structural anchor point inside each individual muscle fiber. This micro damage accumulates over time and actually increases your susceptibility to future cramps rather than reducing it. Third, the sharp, forced motion also activates your sympathetic nervous system, your fight or flight wiring, which constricts blood vessels and reduces the very blood flow the muscle needs to recover. The fix is this: when a cramp strikes, apply a slow, gentle, sustained hold to the stretch, not a pull, a hold. Apply light pressure, hold for 45 to 60 seconds without forcing additional range, and breathe slowly throughout. Slow breathing activates the parasympathetic system, your rest and digest wiring, which dilates blood vessels and speeds recovery. This costs you zero additional time. Mistake number two, drinking less water in the evening to avoid nighttime bathroom trips. This is one of the most common and one of the most damaging patterns I see in patients over 60, and it is entirely understandable. Nobody wants to be up at 3 in the morning walking to the bathroom. So people cut off fluid intake after 5 or 6 p.m., thinking they are making a smart trade off. Here's what they are actually trading. First, the natural overnight fast already concentrates the blood. Plasma volume, the fluid portion of your blood, drops during sleep as water shifts into tissues. When you begin that process already dehydrated, the blood becomes viscous, thick, and slow moving. Delivery of oxygen and electrolytes to the muscle tissue of the legs, which are already the furthest point from the heart, drops significantly. Second, dehydration directly suppresses magnesium and potassium concentrations in the fluid surrounding the muscle cells. These extracellular electrolytes, meaning the minerals outside the cell, are what regulate the electrical charge that triggers and ends muscle contractions. When their concentrations drop, the electrical environment inside the muscle becomes erratic. That erratic environment is, precisely, a cramp. Third, concentrated urine from chronic evening dehydration forces the kidneys to work harder overnight, pulling additional minerals from circulation to manage the filtration load, which further depletes the electrolyte environment in the muscle. The fix: drink 8 to 12 ounces of water with a small meal between 4 and 6 p.m. Taper slowly after that. Do not cut off fluids abruptly. A gradual taper maintains plasma volume without creating the surge of fluid that causes urgent late night bathroom trips. No exceptions. Mistake number 3: sleeping with your feet pointed downward or with heavy blankets pressing on your feet. This one surprises people every time I bring it up in the office. The position of your foot during sleep has a direct, measurable impact on your cramp frequency, and almost nobody is paying attention to it. First, when your foot falls into plantar flexion, meaning the toes are pointed downward, which is the natural resting position for most people lying on their back with a heavy blanket on top, the calf muscle sits in a shortened, partially contracted state for hours. A muscle held in a shortened position for extended periods loses its sensitivity to the relaxation signal. The motor neurons that should be firing to release the muscle between sleep cycles do so against increased resistance, and the muscle is primed to cramp at the slightest provocation. Second, blanket weight across the top of the foot. Even just a few pounds of pressure reinforces plantar flexion and compresses the dorsal blood vessels, those running across the top of the foot, reducing circulation to the toes and the intrinsic foot muscles that support normal muscular balance during rest. Third, sustained plantar flexion through the night also places chronic low grade tension on the Achilles tendon and the soleus muscle, the flat, deep calf muscle beneath the gastrocnemius, which are the two structures most directly involved in nighttime cramping. The fix: tuck your sheets and blankets loosely at the foot of the bed so your feet can sit in a neutral position. If you sleep on your back, place a rolled towel under your ankles to lift your heels slightly and prevent your toes from falling downward. This is free, it takes 30 seconds to set up, and it works on the first night. Mistake number 4: using heat on cramping legs at night. Heat feels incredible when your legs are aching. It's intuitive, it's soothing, and I am not going to tell you that heat has no place in managing leg discomfort. But applying sustained heat to cramping legs at bedtime, hot water bottles, electric blankets set high, very hot baths right before sleep, creates a specific physiological sequence that increases cramp risk through the night. First, sustained surface heat causes vasodilation in the superficial blood vessels, the ones just beneath the skin. This draws blood toward the surface and away from the deep muscle tissue. The deep muscles of the calf, which need oxygenated blood to maintain electrical stability, actually receive less perfusion under sustained surface heat than under neutral or mildly cool conditions. Second, heat raises core body temperature. The body's natural preparation for sleep involves a core temperature drop of roughly 1 to 2 degrees Fahrenheit. Disrupting this drop by applying external heat delays the neurological transition into deep sleep. And deep sleep is when the motor neuron signals that stabilize muscle tissue are most active. Disrupted deep sleep means disrupted motor signal coordination, and that means a higher probability of uncoordinated firing, meaning cramps. Third, excess heat accelerates fluid loss through perspiration, compounding the dehydration risk we discussed in mistake 2, which further depletes the extracellular electrolyte environment. The fix: if you want to use heat therapeutically, apply it for no more than 15 minutes to the calves before getting into bed. Then allow the limbs to return to ambient temperature before you sleep. Warm, not hot. Brief, not sustained. No exceptions. Mistake number 5: ignoring calf cramping as a standalone problem. This is the mistake that matters most, and it is the one I want you to hear most clearly. Isolated occasional leg cramps, especially in adults under 50, may be benign, but frequent recurring nocturnal leg cramps in adults over 60 are, in a meaningful percentage of cases, the peripheral nervous system and the cardiovascular system signaling that something systemic is wrong. First, the pattern of nighttime cramps, worse at rest, relieved by movement, associated with a cold or discolored foot or calf, is a recognized clinical presentation of peripheral artery disease, or PAD, a condition in which the arteries supplying the legs are partially blocked and deliver insufficient blood flow. PAD affects approximately 12 to 15% of adults over 65 and is significantly underdiagnosed. Nighttime leg cramps are one of its earliest and most consistent symptoms. Second, certain medications, including statins, diuretics, and some blood pressure medications, are known to deplete magnesium and potassium and directly cause or worsen leg cramps as a side effect. If your cramps began or worsened after starting a new medication, that is not a coincidence and it is a conversation your prescribing doctor needs to have with you. Third, cramping that is accompanied by swelling, redness, warmth, or hardness in the calf is a potential sign of deep vein thrombosis, a blood clot, which is a medical emergency. The fix: track your cramps. Write down the time, the leg, the duration, and whether the skin looks or feels different. After 2 weeks of tracking, bring that log to your physician and use the word nocturnal leg cramps, not just leg pain. Specific language gets specific evaluation, no exceptions. Now, before I give you the full action summary, I want to ask you something, and I genuinely want to hear your answer in the comments below. How old are you? And how long have you been dealing with nighttime leg cramps? Write it below. This information helps me create better, more targeted content for exactly where you are right now. And I read these comments personally. Mistake number 6: skipping calf strengthening activity because the legs already feel weak or sore. Rest, when legs are painful and tired, feels logical. It feels like protection. But here is the fundamental problem with that reasoning. Sarcopenia, the muscle loss we discussed at the beginning, is accelerated by inactivity. Every day that the calf muscles are not being loaded, not being asked to contract and resist and recover, the muscle fibers that remain are atrophying further. The capillary networks, those tiny end delivery blood vessels inside the muscle, actually physically reduce in number in the absence of regular muscular demand. You cannot maintain circulation to a muscle you are not using. First, inactive calf muscles lose their capacity to act as the peripheral venous pump, meaning the rhythmic contractions of the calf during normal movement are what push venous blood back up toward the heart from the legs. Without this pumping action, venous blood pools in the lower leg overnight, which increases local pressure, reduces capillary exchange efficiency, and worsens the oxygen depletion environment that causes cramps. Second, inactivity reduces the sensitivity of the motor neurons that supply the calf, making the already slowed conduction we discussed earlier even slower and less precise. Third, the psychological loop of pain avoidance creates progressive deconditioning that makes each cramping episode feel more severe because the muscles have less resilience to recover. The fix: perform 25 slow, controlled calf raises twice per day, once in the morning and once in the early afternoon. Not fast, not sloppy. Slow up in 2 counts, hold for 1 count, slow down in 2 counts. This takes less than 4 minutes per session, costs nothing, maintains the venous pump, preserves motor neuron sensitivity, and directly counters sarcopenia. This costs you zero additional time. Mistake number 7: relying on banana consumption as your primary electrolyte strategy. Bananas have become the cultural shorthand for leg cramp prevention, and the potassium in them is genuinely relevant to muscle function. But the banana strategy is incomplete, and for many people over 60, it addresses the wrong electrolyte entirely. First, as we established earlier, the mineral most directly responsible for the failure of muscle relaxation after 60 is magnesium, not potassium. Magnesium is the calcium blocker, the brake on contraction. A medium banana contains roughly 32 milligrams of magnesium. The recommended daily intake for adults over 60 is between 300 and 420 milligrams depending on sex. You would need to eat 10 bananas a day to approach adequate magnesium through bananas alone. Second, excessive banana consumption raises blood sugar rapidly due to the natural sugar load, which in older adults, especially those with insulin sensitivity concerns, creates a glycemic spike followed by a drop. And that blood sugar drop itself can trigger the release of cortisol, which further depletes magnesium from tissues. You are chasing the deficiency with the very food that makes the deficiency worse. Third, potassium and magnesium compete for absorption in the intestinal lining. Consuming very high potassium in the absence of adequate magnesium can actually worsen the magnesium deficit. The fix: broaden your electrolyte strategy to include magnesium rich whole foods. Pumpkin seeds, dark leafy greens, black beans, and halibut are among the highest dietary sources. Aim for 3 magnesium containing foods daily. Keep the banana if you enjoy it, but do not mistake it for a complete solution. No exceptions. Mistake number 8: not having a consistent sleep position protocol for the legs. Most people go to bed without any structured approach to how their legs are positioned, how their sheets are arranged, or whether there is a transition routine that prepares the muscular and neurological system for sleep. The legs are simply wherever they land. First, random leg positioning means that the calf and foot can enter and remain in the plantar flexed, shortened muscle position for the entire night. We addressed this briefly in mistake 3, but the point extends further. Even side sleeping without attention to leg position causes one leg to fall forward and rotate in a way that places the hip flexors and the deep stabilizers of the lower leg under sustained passive load, and that chronic passive loading wires the motor neurons of the leg for sustained contraction rather than rest. Second, the absence of a pre sleep transition means the sympathetic nervous system, the alert, high tone system, remains dominant into the early phases of sleep. High sympathetic tone means elevated circulating norepinephrine, which maintains vascular tone and reduces blood flow to peripheral tissues, specifically including the legs. Third, people who do not have a consistent sleep positioning routine also tend to move more during the early sleep cycle, which disrupts the motor pattern stabilization that happens in light NREM sleep and primes the legs for the sudden, uncoordinated firing that causes cramps. The fix: spend 5 minutes in a legs up the wall position before bed. Lie on your back, raise your legs straight against the wall, hold for 5 minutes. This drains pooled venous blood from the calves through gravity, reduces leg vascular pressure, promotes parasympathetic activation, and prepares the neuromuscular system for rest. It is free, it requires no equipment, and the research on venous decompression before sleep is clear. No exceptions. Now let's bring it all together. Here is your complete action summary. 1. When a cramp strikes, do not pull or force the stretch. Apply a slow, gentle hold for 45 to 60 full seconds. Breathe slowly throughout and allow the parasympathetic system to do its work. This is free and immediate. 2. Do not cut off fluids abruptly in the evening. Drink 8 to 12 ounces of water with your evening meal and taper slowly. Sustained hydration maintains the electrolyte environment your muscles need through the night. 3. Arrange your bedding so your feet can rest in a neutral position. Loosen the sheet tuck at the foot of the bed and place a rolled towel under your ankles if you sleep on your back. Set this up tonight. 4. If you use heat on your legs, limit it to 15 minutes before bed and allow full cool down before sleeping. Do not sleep with heat applied. Warm and brief, not hot and sustained. 5. Track your cramps for 2 weeks. Time, leg, duration, skin appearance, and bring that written log to your physician using the specific phrase nocturnal leg cramps. Specific language demands a specific evaluation. 6. Do 25 slow calf raises twice per day every day, morning and early afternoon. 2 counts up, 1 count hold, 2 counts down. Less than 4 minutes, non negotiable. 7. Expand your electrolyte strategy beyond bananas. Add 3 magnesium rich whole foods to your daily eating: pumpkin seeds, dark leafy greens, black beans. Address the right deficiency. 8. Spend 5 minutes in a legs up the wall position before you sleep every single night. Drain the pooled blood from your calves, reduce vascular pressure, activate the parasympathetic system. This is your new pre sleep non negotiable. I want to close with something important. This channel exists because I watched patients spend their 60s, their 70s, and their 80s, managing conditions that could have been prevented. Not because the medicine wasn't available, not because the information didn't exist, but because the information never reached them in a form they could act on. That is the gap this channel is designed to close. Nobody at your next appointment is going to walk you through an 8-point protocol for nighttime leg cramps. They're going to have 11 minutes with you and a prescription pad. The system profits when you stay sick, not when you get well. I refuse to accept that, and if you're still here, I believe you do too. We are building a community of 100,000 people who are choosing to understand their own bodies, to act on that understanding, and to take their health back from a system that was never designed to give it to them. Subscribe. Share this with someone over 60 who is losing sleep to this, and I will see you in the next one.